Hello everyone. This is Isha, and in this video, today we are going to cover our chapter number 3, that is Reproductive Health of Biology, class 12th. Okay, so as you all know, this is a revision series, so we are going to revise from basics. Okay, every NCERT line is we will cover. Okay, and we have already completed our three chapters, that is Principle of Inheritance, Evolution, and third one is Microbes in Human Welfare. Today it's our fourth chapter, that is Reproductive Health. Okay, so let's start. According to World Health Organization, that is WHO, reproductive health means, what does reproductive health means? Okay, a total well-being in physical, mental, emotional, behavioral, behavioral and social aspect of reproduction. Okay, so okay, what does WHO says about the reproductive health? So, according to the name, if we see the reproductive health means reproductive organs health, okay, but it is not like that. Okay, reproductive health, what from by the WHO, what does they convey? Okay, so they convey that total well-being is in physical, mental, emotional, okay, behavioral and social well-being is said to be aspects of reproduction. Okay, so a reproductive healthy person is one who has physically and functionally normal reproductive organs and normal behavioral and emotional interaction with other person in all sex related aspects. Okay, so what they said, WHO said that emotional, mental, physical, okay, oh, aspects, excuse me, here mosquito was there, so I was just distracted. But see, according to WHO, reproductive health means the overall well-being in the physical, mental, emotional, behavioral, social aspects of reproductive are the reproductive aspects. Okay, and the reproductive healthy person is who, though, is one who has uh, normal reproductive organs, yeah, and physically functioning, those are functioning also. Okay, and normal behavioral and emotional interaction with other person in all sex related aspects. Okay, yeah, so government of India initiated number of programs to attain reproductive health as social goals. Okay, so what does government of India does in reproductive health? So government of India initiated number of programs. Government initiated started many programs. Okay, for like attain reproductive health. Okay, and it is also a social goal. Okay, family planning were initiated in 1951 by government. Okay, family planning. Okay, and improved programs like reproductive and child health care, PRCH, sorry, RCH, reproductive child health care programs were also improved. Okay, what we have read till now? So we have read RCH programs, we have read family programs initiated by government of India. Okay, we have read what uh, who is a healthy reproductive healthy person. Okay, and we have read the definition of reproductive health. Okay, according to WHO, so the main aim of such programs like RCH, the family planning program. Okay, so the main aim for such program to create awareness among people about reproductive organs. Okay, about adolescence and associate changes, safe and hygienic sexual practice. Okay, sexually transmitted disease, social evil like sex abuse, sex related crime and provide facilities and support for building a reproductive healthy society. So main aim of such program is of these programs is to like develop so yeah, the main aim of such program is to uh, develop or build up reproductive healthy society. Okay, what is now, what does a reproductive healthy society means? Okay, so it means that there is no sex abuse. Okay, if there is, that society is reproductive healthy society, so there should not be any sex abuse, sex related crimes. Okay, and okay, and there should be like no STDs. Okay, no social abuse like sex abuse and these. Okay, there should be hygienic sexual practices. Okay, and people should know, people should aware of like their reproductive organs, the adolescence, the changes which is occurring during puberty and adolescence. Okay, and we should stop the social evils like sex abuse, sex crimes. Okay, and one more was there, providing STDs. Oh, stop STDs. Okay, fine. Next is the important program of healthcare centers under which people are educated about available birth, okay, birth control option. So the important program of healthcare centers under which people are educated about available birth control options, care of pregnant mother, postnatal case of the mother and child. Okay, so what is important in these healthcare programs? To control the birth control rate. Okay, okay, to take care of pregnant mothers, to take care of postnatal case. Okay, postnatal case of the mother and child. Okay, so take post, like we are taking care of a mother before, like in pregnancy or during delivery, but we should also care her very very much, be carefully about the postnatal. Okay, postnatal, when delivery is done completed, so we should take care of the child and mother as well. Okay, and there is a pill or like oral contraceptive that is named Saheli. So what is Saheli? Questions are coming like new oral contraceptive for female developed at Central Drug Research Institute. So CDRI, Central Drug Research Institute. Okay, uh, developed a new oral contraceptive for females. Our next topic is amniocentesis. So, what is amniocentesis? Amniotic fluid of the developing fetus is taken to analyze the fetal cell and dissolved substance. Okay, so in amniocentesis, it is a process. Okay, we'll study it later in this part only. So, firstly, we should know what is amniotic fluid. Okay, so amniotic fluid is the developing fetus of the developing fetus. Fetus, like fetus is here, around it's the cavity is there, so there is a amniotic fluid. So amniotic fluid of the developing fetus is taken. That fluid is taken out, in which there are some fetal cells and dissolved substances of fetus. Okay, so because of this, uses, what are uses of amniocentesis? Test the presence of genetic disorder to check whether the child is facing any disorder, genetic disorder or not, like Down syndrome, hemophilia, sickle cell anemia, etc. Also, to determine survivability of fetus. Is the fetus surviving, or is it died, or is it killed? Okay. Or how it is misused. This misused question is every time asked in every question, and even case basis coming from this chapter, from this topic. Okay, so misuse to determine the sex of unborn child, mainly leading to female feticide. Okay, female feticide means female uh, feticide was killed. Okay, to determine the sex of unborn child, this amniotic fluid is taken, and this process is only known as amniocentesis. So, so female feticide were very much killed. Okay, that is why there was statutory ban on amniocentesis for sex determination to legally check increasing danger of female feticides. So there are much female feticides because of this process. So government banned this process for sex determination to to check like danger, because there is no danger if male are population is increasing and females are less, then that's danger for our population also as well. Okay, for girls as well. Now, what we have read till now, we have read what does definitions of reproductive health according to WHO, and what does reproductively healthy person is. Okay, who is a reproductive healthy person? Okay, we have read programs initiated by government. Okay, first is family planning. Okay, RCH, reproductive and child health care program. Okay, then there were main, what are the main aim of such programs like RCH and these. Then we have read about the like important program of healthcare. Okay, then Saheli we have read. Then we have read amniocentesis, amniotic fluid. Okay, genetic disorder, survivability. Okay, then fetal cells, unborn child, feticide, statutory ban, and data sex determination. Okay, now we are on our next topic, that is population explosion. So how does population increase? How is this uh, reproductive health topic is related to population? Okay, so let us read. Increased health facilities along with better living condition had uh, had explosive impact on the growth of population. Okay, so these, when the government increased the health facilities and along with, and there is better living conditions are provided to the mother and child during reproductive phase or delivery phase, or everything, awareness is provided by government. So during this, what we have seen explosion in population. Okay, so like there is like data given in our NCRT. Let us read like population year, which year, world, then India. So in 1990, total population of world was 2 billion. Okay, in 1947, of population was India was 350 million, and in 1990 of world it was 2 billion. Billion and million are very different. Okay, now in 2000 world was 2 billion and India was 1 billion. Got it? In 2011, world was 7.2 billion and India was 1.2 billion. Got it? So possible reason of population explosion. What are the possible reason why population uh, increases very rapidly? Okay, so increased health facilities along with better living conditions increases population. Okay, also when there is rapid decline in, if the like see, better living is there, better healthcare routines are there, so there will be less death. Okay, so there will be decline in death rate, infant mortality rate, okay, maternal mortality, okay, because of mmr, imr and death rate decline. So therefore population increases. Okay, increase in number of people in reproducible age. So when the people are like in age of reproducing, so according to that also our population increases. According to 2011 census report, the population growth rate was less than 2%. That is 20 per thousand per year. 20 people per thousand people in per year. 20 by thousand means among 1000 people, India contribute 20 people in a year. Okay, 2%. The population growth rate was less than 2%, according to 2011 census report. Okay, now we have seen what are the reasons for population increase. Now, how can we control measures to check population growth rate? Okay, so how to control these measures, how to control the population? Okay, so first is to motivate smaller families for using contraceptive methods. Smaller families can use now contraceptive methods to reduce the rate of reproducing the child. Okay, aware people about different types of slogans like hum do hamare do, so that population size decreases. Okay, third is many young and working couple have adopted one child norm. So the young people and the working people who cannot like take care of many children, so they have just uh, adopted the one child norm, then they will have only one child. Okay, and raising of marriageable age of the female. So first what was happening was like there was child marriages. Okay, due to which there was like many children's up to 40 years 55 years of female. Okay, like our grandparents, granddaughter, grandfathers have their like 12 sisters or 15 brothers sisters. Okay, why? Because their mothers got child, maybe their mothers was a child marriage. They have done child marriage because of which till the age of 40 and 55 they reproduce, and there were no using of like contraceptive methods. There was no awareness because of that. So population size already increases. To decrease the to control this measure of population, what we can do, what government does, so government does increases the marriage age for female 18 years and for males 21 years. Yeah, before this there is we cannot do, and if anybody does, so there is a punishment for that. Fifth is incentives given to couple with small families. Yeah, like incentive means what we can say, offers or like offers or in form of like they are going into any job, they got some incentives, so some like offers types things. Okay, with small families. Now next is our important topic and very big topic. Okay, okay, till I think it's still here. So our next topic is contraceptive methods. What are contraceptive methods? Contraceptive methods are in which we can uh, stop reproducing. We can cause, we can just cause and reproduce. We can, like, what are these? Huh. So contraceptive methods are, means, they contracept the process of reproduction, means they resist reproduction. Okay, so features for of an ideal contraceptive. For what are ideal contraceptive, let us read now. Sorry, sorry. So ideal contraceptives are user friendly, easily available, effective, and reversible. Okay, they can be reversed, they are effective, they are easily available, and they are user friendly. Okay, and no or less side effects are seen. It should not interfere with the sexual drive, desire, and sexual act of user. Okay, okay. So there are, I think, one, two, three, four. Sorry. So there are seven methods of contraceptive methods. Let us read. Excuse me. So, hello everyone, welcome back to my channel. Not because yesterday, as you all know, I was not well because of my nose and my voice. My voice was not clear, so I was unable to like do revision and record the video. So today I'm continuing this chapter, okay, from contraceptive methods. Before this only there were two topics only. So we have already covered that yesterday. So today we'll begin with contraceptive methods. And also let me tell you one more thing, that today I'll complete this chapter as well as my another chapter, that is biotechnology and its principles. Okay, so let's start without any delay. In that biotechnology I'll cover in another video. Okay, so let's start. What are contraceptive methods? Okay, what is ideal contraceptive methods? What are ideal contraceptive methods? So contraceptive, to be ideal, they should follow some rules. Okay, they should follow some circumstances. Okay, first is they should be like user friendly, means the user is able to use it, okay, properly and without any like, it's comfortable. Secondly, easily available, means in market it should be easily available. It should be effective. There should be less to less failure rates. Okay, and it should be reversible. Reversible means they can be uh, come in use uh, after use also. It means after using they can be come again in use. Okay, so that means reversible. So no or least side effect should be there for an ideal contraceptive. It should not interfere with the sexual drive, desire, and sexual act of the user. So this contraceptive should not be act as an interfere in like sexual desires, okay, or like sexual drive or sexual act of the user who is using this contraceptive actually. Okay, so now for contraceptive we have five to six methods. So from, and in those also we have sub methods. Okay, so first is a natural method. In natural method what we do is, it works on the principle of avoiding chance for coitus. Okay, coitus, chance of ovum and sperm meeting. So, natural method is a method in which we prevent the meeting of ovum and sperm. Mainly, we prevent fertilization event. Okay, so it works on the principle of avoiding chance to of ovum and sperm meeting. Okay, then features. What are the features of this natural method? Many times I've seen these questions is coming, that describe the features of this, describe the functions of this. Okay, so let us see features of natural method. So features are like, they do not require any device or medicine. Okay, so because this is natural, so there is no use of devices or like medicines. They have higher failure rate. Okay, this is natural. That is why they have like failure rate, because there is no like uh, assurance of like the the ovum and sperm will not meet. They can meet, okay, sometimes we can be wrong, sometimes nature can, natural methods are obviously wrong, okay. These have side effects. So how, like when we take any device or like medicine, there are some side effects, okay, but for natural method there are nil side effects, okay. Now, in natural method there are three subdivisions, okay. First is periodic abstinence. Periodic abstinence. Second is withdrawal or coitus interruptus, okay. Third is lactational amenorrhea, that is absence of menstruation, okay. So let's start with periodic abstinence. So, what is periodic abstinence? Periodic means time related something. Abstinence means to stop, abstain. Okay. So, let us read about this. So, in this method, couple avoid or abstain from coitus from day 10 to 17. Okay. Of the menstrual cycle, when ovulation could be expected. Means what they are saying, when ovulation, what is ovulation now? Meeting of like when ovum is released from ovary, okay, the time period is known as ovulation. So when ovary is releasing ovum, okay, at that time the ovum remains in the fallopian tube for I think 28 hours one day, and means 7 hours something. So for 42 hours, sorry, I think I may be wrong, but I think 42 hours, but let us see. So ovum is there. If there will be no sperm entry during that process, means there is no fertilization. So they are taking care of this only, that during the time of ovulation, that is day 10 to day 17 of menstrual cycle, they could avoid like meeting. Okay, so in method, couple avoid abstain from coitus day 10 to day 17. Okay, first of all, when I have read this, like when I just entered in 12th class, so I was very like for 2 3 months, I was not knowing what is meaning of coitus. So coitus is basically the meeting of the couples, the like insemination process we can say is coitus, okay. So could be expected. Secondly, the chance of fertilizations, okay, are very high during this period, fertile period. So why during, we should not do like during ovulation? Because as I told, ovum is staying in fallopian tube, so there is very high chance of fertilization during this period, and this period is also known as fertile period. That is why, okay. So because reason like they can come in a certain reason, or they can ask us directly why there should be no, because that is fertile period na? There are very high chances of fertilization, yeah. Now, second is withdrawal or coitus interruptus. As a name, withdrawal means withdrawal, something we have like taken, yeah, we have withdrawn, okay. And coitus means sexual interruptus, sexual intercourse during interruptus, we have stopped them, yeah. Coitus is basically sexual, that what I have said, ejaculation, sexual, I said something now. I forgot, just now I forget, because I was like coitus have its own name, and I have mentioned it in NCRT as well. And I'm, when I learn, okay, when I will just remind, I'll tell you. So withdrawal or coitus is sexual intercourse. Yeah. So withdrawal or coitus interruptus. In this method, male patron withdraws his penis from the vagina just before ejaculation, so that to avoid insemination. See, this is the most like it have much failure rate. Why? Because even if it is a that ovulation period, just before, how they know that this is only the ovulation period? How they know that now only sperm will take entry? Yeah, anytime sperm can take entry. So in this method, male pattern just before ejaculation or to avoid insemination, okay. So our third is lactational amenorrhea. It is asked many times. From natural method, this is asked. Okay, so let us read. Lactational amenorrhea, that is absence of menstruation. So, ovulation and cycle do not occur during the period of intense lactation following parturition. So, after parturition, there is a lactational phase for a mother. Yeah, so when the mother is feeding at that time, in that particular mother, the menstrual cycle for some time, some like months, like so in some cases like year also, 1 year. Okay, but particularly it's like for months, it's common that menstrual cycle or ovulation does not happen. So as long as mother breastfeed the child fully, okay, there are fully chance of conception and almost nil. Okay, so conception means to like conceive, to like be pregnant. Okay, so there are fully chance of conception are almost nil. Conception chances are nil. Okay, so effective, okay, it is effective from how much time, like period of time it is effective. So it is effective up to 6 months following parturition. After parturition till 6th month, it is like effective. Okay, why? Because at that period of time the mother is feeding child. Because of that, lactation period is stopped. Lactation, no, ovulation so does not happen. Okay, our second natural method we have read in that periodic abstinence. Second, withdrawal or coitus interruptus. Third is lactational amenorrhea, that is absence of menstruation. Second is barrier method. Okay, ovum and sperm. Sorry for that because I have problem in my nose, but we should focus. Yeah. So barrier method. Ovum and sperm are prevented from physically meeting with the help of barrier. So barrier method is, what is barrier? To like stop something. Yeah. After using like uh, using devices, using medicines. Yeah, that is barrier method. Using some like wall we are using. Yeah, basically wall or like barrier is like resistance, disturbance, like barrier is that. Barrier method, ovum and sperm are prevented from physically meeting. Means in this there were avoiding chance of ovum and sperm meeting, but in this we are providing the meeting of sperm and ovum physically. Okay, help of barrier. Now first is in barrier method is condoms. Okay, so what are condoms? So these are made up of a thin rubber, okay, or latex sheet. Okay, so what are condoms? So condoms are the devices of like contraceptive devices which are made up of sheet, latex sheet and rubber, thin rubber. Okay, it is used to cover the penis, okay, penis in the male or vagina and cervix in the female. So we should focus on this point as well. Sorry, that condoms are not just for males, okay, for covering penis, but also for females for covering vagina and cervix. Okay, two parts. Not anyone know any three. Okay, so two parts in female, vagina and cervix. So what are its features? So feature is it prevent the entry ejaculated semen into the female reproductive tract. So it like stops the semen only. Okay, it covers the penis. Okay, so the semen which is released from the penis is stopped there by that barrier, that is condom, rubber sheet. Okay, okay. Nirod. What is Nirod? So Nirod is a popular brand of condoms for male. Okay. So Nirod, many times we in paper I have seen one Saheli and one Nirod is asked. So what was Saheli? Yesterday I have read. So Saheli was like here. See here. I've read Saheli. It's just roll. I have read. Leave it. Yeah, here. Saheli, new oral contraceptive for females developed. Okay. Saheli is basically pills for females, and these are barrier methods. Okay, Nirod is a company. Okay, so what are its advantages? So advantages are like both male and female condoms are disposable. They are disposable. Okay, can be self-inserted. Okay, and give privacy to the user. Okay, also protect user from contrasting STIs and AIDS. Okay, main is like they are like protecting user from sexual transmitted infections and acquired immunodeficiency syndrome, which are very harmful basically. Okay, in barrier method, now there is second subdivision, that is diaphragms, cervical caps or vaults. Okay, so these are basically devices used as barrier. Okay, so they are made up of rubber and inserted into the female reproductive tract. Okay, these all three are inserted into female reproductive tract. Okay, to cover cervix during coitus. So basically, condoms in female are covering vagina and cervix, but diaphragm, cervical cap, warts, these all devices are covering only cervix. Okay, done during coitus. Okay, sexual intercourse. They prevent conception by blocking the entry of sperm through cervix. Why the like inserting it only in vagina? Why not in another part? Because they are blocking the entry of sperm. If the sperm does not come, then the entry is physically like blocked. Yeah. So they are reusable. These diaphragm, cervical caps or walls, they are reusable, but they were like we cannot use like again those condoms because they are disposable. Okay, they are not, I think, reversible. Yeah. Now the important part of this diaphragm, cervical caps and walls is that spermicidal, they have like spermicidal creams, jellies. No. Yeah, some of like spermicidal creams, jellies and foams are also used along with barrier to increase their contraceptive efficiency. So with these all contraceptive methods, some of the cream, jellies, okay, these spermicidal creams, basically spermicidal to stop the entry of sperm, these are like also used as for increasing the contraceptive efficiencies. Okay, now we have read natural methods, three subparts. We have read barrier method, two subparts. Now third is our intrauterine devices. Intrauterine, something related to uterus devices, IUDs. Okay, these devices are inserted by doctor, okay, or expert nurses, okay, in the uterus through vagina. Okay, I've written vagina. Sorry, vagina. So first is, there are two types, I think. Yeah, so first is non medicated IUDs. Non medicated. Okay, example, lipase loop. Second is, I think, non medicated. I don't know the meaning. I think non medicated means there is no like use of medicines. That is lipase loop. Copper releasing IUDs. The IUDs, intrauterine devices which release copper. Yeah, copper ion. Okay, what now they release copper. So what does copper does? So copper ion suppress sperm motility and fertilization capacity of sperm. So fertilization capacity decreased by this Cu copper, and they also decrease the sperm movement, sperm like transformation, motility, movement basically. Yeah. So example of this is a copper T, CUT, Cu7, copper 7, and multi-load 375. Okay. We have read two subparts, non-medicated. We have read copper releasing IUDs. Now, third is hormone releasing iuds, the hormones which release, the iuds which release hormones. Okay, so they make the uterus unsuitable for implantation. So they release some hormones which are like, they like means implantation cannot happen there. Okay, so they make uterus unsuitable for implantation. Okay, the cervix that is hostile to sperm. Okay, example, through progestasert lng20. So the which the IUDs, example of hormonal IUDs is progestasert LNG20. LNG20 and progestasert, copper CUT, CU7, multilord 375, okay, and non-medicated lipase loop. Now, it's here is a point, okay, it's make unsuitable for implantation hormone, but also it make the cervix hostile to the sperm. Hostile means like killing something, killing sperm. Yeah. So iuds, what does iuds does? Ideal contraceptive for female who want to delay pregnancy, who want like gaps in children's, yeah, who want like, now I'm not able, like I'm not capable, I'll do later. So for them, space children, okay, mostly widely expected accepted method of contraception in India. So in India, basically IUDs are like in use, most in use, much. Okay. So intrauterine devices, we have read three: non-medicated and medicated. May it's coming copper T and hormonal releasing IUDs. Now our fourth contraceptive is oral contraceptive. So oral contraceptive has some parts. Let me see. No, oral contraceptive does not have any part. No subdivisions. Okay. So oral administration of small dose of either progestogen or progestogen. Oh, progestogen estrogen combination. Okay. For oral contraception, even the oral administration of small dose is given. Oral contraception means pills they are giving, or something like dose they are giving. So small dose of either progestogen alone, okay, either estrogen progesterone combined is given, okay, by oral administration. Okay, they are used in form of tablets. Okay, they are given like tablets, and hence popularly called the pills, and they are called pills. Okay, so oral contraceptive is basically pills. So what are pills? They are like tablets which are called pills. Pills are taken daily for 21 days, starting preferably within first 5 days of menstrual cycle. So pills are taken daily for 21 days regularly. And when we have to start? So we have to start from 1 to 5 days of menstrual cycle. We can take 2, 3, 4, 5. So basically doctor are like suggesting to take on like 3 day, 2 day, 2 or 3 days, because if the person forgets to take in 4 5, so that is like gone, like. And also these pills were given to me. Okay, let me tell you, because these are also given to the girls or women who have irregular menstrual cycle. Okay, so that 21 days they take, and again the we have to stop for 7 days, then again 21 days we have to take. Okay, so pills are taken daily for 21 days, starting preferably within first 5 days of menstrual. Okay, after a gap of 7 days during which menstrual cycle occur, it has to be repeated in the same pattern till female desire to prevent contraception. Till how much time? Till the contraception, she doesn't want contraceptive. So they have, yeah, failure rate they have like very less, but yeah, they have like uh what we have read like uh, uh, this side effects. I'm like forgetting names because I'm reading this and I'm not reminding the particular name. Okay, so we have to write. Okay, so first is Mode of action. What are the mode of action for this? So it like inhibit ovulation implantation. Okay. After quality of cervix, mucus to prevent alter quality of cervix, mucus to prevent angiosperm. So in cervix only it provide a like very thick mucus which prevent the entry in the vagina, in the uterus for sperm. Okay, pills have lesser side effect. Huh? They have side effects, but very less side effect. Okay, Saheli. Saheli, we have read like Nirod, we have read. Okay, so Saheli is also a like pills. So non-steroidal preparation. Okay, Saheli. Very few side effects. High contraceptive value. Okay. Now our next is we have read like natural barrier, IUDs, oral contraceptive. Now third, our fifth is injection and implant. So by like we have taken tablet pills. Okay. Now from injections and implants also like some implant near bone near nerve. Okay, given injections also. So progestogen alone or in combination with estrogen are used by female as injection, as like tablets is similar as injection or implants under the skin. Okay, their mode of effective period, their mode of action is similar to the pills as their effective periods are much longer. So they are effective for less like 1 month, okay, 21 days. Okay, but their like effective period is more because they are implants. Okay, they are injections. Okay, injection taken for the how much long period you does not want like contraceptive conception conceive, you does not want, you did not want to conceive. Now our next is sixth, that is emergency and contraceptive. Emergency contraceptive. Okay, in emergency what we can do in crime cases and where like forced contracept coitus is done. Okay, during rape cases. Okay, so emergency contraceptives, administration of progesterone estrogen combination or IUD within 72 hours. IUDs, okay, intrauterine devices within 72 hours are given, hours of coitus, okay, have been found to be very effective as emergency contraceptives. Okay, so they could be used to avoid possible pregnancies due to rape, casual, and unprotected intercourse. Okay, this I have told you, it's very easy that within those 72 hours of coitus we have to uh, the individual, the woman or the girl is given IUDs or the uh, progesterone estrogen combination pills. Okay, okay, emergency to avoid in which cases like rape, intercourse. Okay, possible pregnancies they does not want. Okay, now seventh is our surgical method. Okay, so seventh part is surgical method. It is used, it is also called sterilization. Sterilization. Okay, terminal method to prevent any more pregnancies. So it is terminal means it cannot be reversed. If once it's done, it cannot be reversed. Okay, to prevent any more pregnancies. Surgical invention block gamete transport and prevent conception. So they block gametes only. Gametes, ovum, and the sperm. They block gamete, okay, to prevent conception. Okay. So first there are two sub divisions in this. First is vasectomy and second is tubectomy. So these are very important. The diagrams and those I have read like sample papers, so I have seen these questions. Vasectomy, and let me tell you, in my pre-board exam, I have done these topics say one question wrong. Why? Because I think like tubectomy means it's a tube and it's about vasectomy means that fallopian tube I have read, I think, in vagina and this. But in tubectomy, vast difference and this I am not reminded. So vasectomy, sterilization procedure in males. Okay. So in this method, small part of vast difference. So vasectomy means a vast difference. Okay, is removed or tied up through small incision made on the scrotum. So first they do like scrotum is there. They make a incision in that. They make small cut. Okay, then the method small part procedure. Okay, vast difference is removed or tied up. Whether either they like remove full vast difference so that transportation transformation of like sperm does not happen, or either they cut and tie up vast difference to stop or to prevent the gamete transfer. Okay, transportation, prevent any more pregnancies. So block gamete transport, prevent conception. Tubectomy is about fallopian tube. Sterilization procedure in females. In this method, small part of fallopian tube is removed or tied up through small incision made in the abdomen through vagina. Okay, these techniques highly effective. Poor reversibility means reverse they cannot be. In some cases, it can be like tied if they have tied up, so they can open and they can just make stitches, but poor reversibility. Now, 14th is no, our contraceptive methods are completed. Understood? First, we have read ideal contraceptives. Okay. Then we have read natural method, that is periodic abstinence. Second was um, that withdrawal or coitus interruptus. Third was lactational amenorrhea, that is absence of menstrual cycle. Now third was like second part was barrier method. First was condoms and second was diaphragm walls and cervical caps. Now third is IUDs. Okay, in IUDs we have read about non-medicated IUDs and copper releasing IUDs and hormonal releasing IUDs. Then we have read after IUDs we have read like oral contraceptives like pills. Okay, we have read then injections and implants, then emergency contraceptive, then surgical method, that is tubectomy and vasectomy. Now we are up to MTP, medical termination of pregnancy by doctors. Now here we are by doctors like MTP, and we will read about STI. You know, STI infertility. We'll read about this. So, what is MTP? So, intentional or voluntary termination of pregnancy. Intentional means we know that we do not want now any pregnancy. We are clear about that. So, before full term is called MTP or induced abortion. So, basically, in this we do like abortions. Okay, so intentional or voluntary termination of pregnancy before full term is called MTP or induced abortion. So nearly 45 to 50 billion MTPs are performed in a year all over the world. 45 to 50 million, in a year over the world, which is one fifth of total number of conceived pregnancy in a year. Means from overall population, this 45 to 50 billion is 1 by fifth of total number of conceived pregnancies. Means pregnancy, how much they have conceived, out of them one fifth they have abortions. Okay, from this population. Government of India legalized MTP in 1971. Okay, in 1971 with strict condition to avoid misuse. Okay, so MTP is abortion. Okay, which was like misused very much earlier. Okay, but in 1971 government have like have given like strict rules to follow it, and it have legalized, but for just like term and conditions were given by government. Okay, so let us such restrictions are more important to check illegal female feticide. So first, what was happening, you all know, in Haryana, in like UP and these states. Okay, so female feticides were very much, because there was MTP and there was no, like that was not illegal, illegal. Okay, but in 1971, whether it was illegal, but then also they cannot check the sex of the child. This was their term and conditions of government, and it is, there have been a drastic change in the population of females in this area, because there is now also this happening, but very less. Okay, so such restrictions are more important to check illegal female feticides. What are the importance of MTV? So first is avoid unwanted pregnancy due to casual intercourse or failure of contraceptive during coitus. If this MTP, avoid unwanted pregnancies, okay, due to which are like they avoid pregnancy because which is happened due to like casual intercourse or failure of contraceptive during coitus. Okay, essential in case of continuation of pregnancy could be harm to mother or fetus or both. Okay, you know this. Only one are there, no? Yeah. Now MTP are considered safe during first trimester. First trimester, that means up to 12 weeks for pregnancy. So MTP is basically abortion only, legal abortion. Okay, so that is from MTP. It is only legalized or like safe up to for 12 weeks. Okay, first trimester. Second trimester abortion are very risky, that is up to 12 weeks. Okay, first trimester is like 1 to 3 months. After 3 months abortion are very like problem, like risky. Okay, so what are problems related to MTP? So majority of MTPs are performed illegal by unqualified quack. The doctors or the quacks, the doctor who haven't been like, who are in the process of doctor, that are known as quacks. So much like they are, these MTP are used illegally by them. Okay, misuse of amniocentesis, yeah, if the fetus in female, it is followed by MTP. If the fetus is female, it is followed by MTP. So if the fetus is female, then MTP they do abortion. Yeah, such practices are dangerous for young mother and fetus. Okay, yeah. Effective counseling on to avoid unprotected coitus and risk factor involved in illegal abortion. Yeah, we all know this, and these are like MTP is important asked, and just this was MTP, like problems, like advantages. Okay, and what is actually MTP? Now our next topic is, we have read like basics about reproductive health, then we have read contraceptive methods, no, then we have read population analysis, then we have read contraceptive method, three topics. Fourth topic we have read MTP. Fifth topic we are going to read STI, that is sexual transmitted infections. So disease or infections which are transmitted through sexual intercourse are collectively called STIs, or venereal disease or reproductive tract infections. Example: gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, or HIV leads to AIDS. Okay, these are like one, 2, 3, 4, 5, 6, 7, 8. 8 disease. I'll read this, I'll learn this. First I'll read brief, then I'll read. So hepatitis B and HIV transmitted by shearing needles or surgical instrument. So when they do like surgery or anything, so the needle which they use, so because of that needle also they can be transmitted from one body to another. Okay, hepatitis B and HIV. Um, high immuno. What is HIV full form? Human immunovirus. Immuno. Human immunovirus, something like that. Yeah. So these are transmitted by sharing needles or surgical instrument, by even by transfusion of blood, yeah, from infection mother to fetus. So the mother to fetus, okay, except hepatitis B, genital herpes, and HIV. In infections, other diseases are curable if detected early and treated properly. See, hepatitis B, genital herpes, and HIV. Can they have, like, in world there is no solution for this disease, but other disease, other sexual STIs, they can be curable if they are like detected in early stages. In like delayed stages they cannot be also cure, but in early stages, yeah. So, what are early symptoms? How we get to know? Okay, so that is itching, fluid discharge, slight pain, swelling in genital area between pelvic region. Basically, pelvic region only. So, okay, so infected female may be symptomatic or symptomatic. Okay, okay. Later complication, pelvic inflammatory disease. In later this was early stage, but in later stages there can be like it is this where it was, genital area is present in pelvic region. So pelvic region also got very like diseased or inflammatory. Okay, that is also known as pelvic inflammatory disease. That is PID. PID, because in later, okay, they led to ectopic pregnancies. Okay, what is ectopic pregnancy? A case of pregnancy in which that is harmful, basically. Cancer of the reproductive tract. Okay, stillbirth, infertility, abortion, all are this because of this STIs. All people are vulnerable to STIs. High 15 to 24 years. From 15 to 24 years, most of the like people have STIs. Because how can we prevent these? So we should avoid sex with unknown or multiple partner, which we don't know. We should like prevent that sex and multiple partner, which is happening in today's world. Yeah, so we should avoid that. For not having STIs, we should use condoms during coitus. Like we have read in barrier method that condoms are like prevent AIDS and HIV also, STIs also. Okay, so in case of doubt, go to qualified doctor for early detection and treatment. Okay, so this was that. So let us learn about these. These are hepatitis B, HIV, genital herpes, uh, AIDS. HIV, AIDS are I think 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, 9. HIV, AIDS, genital herpes, hepatitis B, genital warts. Okay, genital herpes, genital warts, B, HIV. Okay, now gonorrhea, syphilis, chlamydiasis, and trichomoniasis, gonorrhoeophilus, candidiasis, trichomoniasis. Okay, I'll write and then I'll practice this. But I have written, see, HIV, AIDS, hepatitis B, okay, genital herpes, genital warts, gonorrhea, syphilis, trichosis and trichomoniasis, chlamydiasis, and trichomonas. something like this. I'll write bracket and then I'll write. Our next topic is, that is last topic, that is infertility. So because of in STIs, there is in many cases infertility occur, and this is also like genetically also sometimes. But let us read. It is the inability to produce children in spite of unprotected sex. Okay. Possible reason: physical, drugs, physiological, okay, or congenital immunological disease. Okay. The couples could be assisted to have children through certain special techniques. Infertility, what is infertility? Then how they can have children? So first is by assisted reproductive technologies. Assisted reproductive technology. In that first is test tube baby programs. So in test tube baby programs is first is hmm, test tube baby programs, that in test tube we like we meet like we make embryo basically, and we meet the ovum and sperm meeting we does. So in vitro fertilization, fertilization of male and female in similar conditions. Okay. Ova from wife, that is donor female, or sperm from husband or donor male are collected and are induced in in form of zygote under stimulated condition in laboratory. So they are fused in laboratory under the same condition as in male and female. Okay. To form zygote. In vitro fertilization, zygote is formed. Okay. So embryo up to zygote have many stages. Embryo up to 8 blastomeres, we have read 8 blastomere, is transferred into the fallopian tube. See, when zygote is formed and it is inserted in body, that is in vitro fertilization. There is a subdivision of this, that is ZIFT. So embryo up to it means embryo when it becomes eight up to 8 blastomeres is transferred into the fallopian tube. That is zygote intrafallopian transfer. Zygote intrafallopian transfer. Second, embryo with more than 8 blastomeres is transferred into uterus. So that is intrauterine transfer, IUT. Okay. That is test tube baby program in which zygote is formed, that is in vitro. Then embryo up to 8, that is ZIFT, zygote only. Then is next, so intrauterine transfer, that is embryo in uterus. Our second is intracytoplasmic sperm injections. So in infertility there are four cases. First we have read test tube baby program. Second is intracytoplasmic sperm injection, ICSC, intracytoplasmic sperm injection. As a name only, sperm injection they are giving in the cytoplasm, like when ovum maybe. So a laboratory procedure in which a single sperm from male partner is injected directly into an egg. Okay. From female partner, then fertilized egg is implanted into the woman uterus. Okay. Then fertilized egg which is fertilized, that is implanted into woman uterus. Got it. Gamete intrafallopian transfer, GIFT. It is asked. I'm telling you, gamete intrafallopian tube many times. From this chapter particularly, I'm telling you. So G gamete intrafallopian transfer. So it is used in females who cannot produce ova but provide suitable environment for fertilization and for the development of embryo. Okay. Ovum for it is used for females who cannot produce ova. So they cannot produce ova, but they can produce suitable environments which are like important for fertilization and for the development of embryo. So ovum from donor female is surgically removed and then introduced into the fallopian tube of female incapable of producing ovum for fertilization. Then, fourth is artificial insemination technique, AI. So this insemination process, so that process is doing artificially. The semen collected from the husband or a healthy donor is artificially introduced in the vagina or the uterus, IUI, intrauterine insemination of the female. The technique is useful for the male partner having inability to inseminate female or low sperm count. Done. So we have read infertility, four phases. We have read. So this was the chapter. Hope you liked it, and sorry for the in continuation in the main, and you can understand. Okay. So this was yesterday. On the place of this chapter, I have solved the sample paper. It's not basically sample paper, but it's a test for the three chapter which we have covered. Okay. So now after this video, I'm going to cover biotechnology and principle in next video. So stay tuned and thank you for watching.